This medication is used to prevent allergic symptoms in the nose. It reduces stuffy/runny nose, mucus dripping into the back of the throat, itching, and sneezing caused by seasonal allergies, hay fever, and other allergens, such as dust mites, pet dander. This medication is not an antihistamine and does not provide immediate relief from allergic symptoms. It should be used before contact with the allergen. Cromolyn is known as a mast cell stabilizer. It works by preventing the release of certain natural substances, histamine, SRS-A, made by the body that cause allergy symptoms. Do not use this medication to treat sinus infection, asthma, or cold symptoms. The recommended daily dosage is usually 1 to 2 sprays in each nostril 3 to 4 times a day, or as directed by your doctor. It is best to use this medication at evenly spaced intervals. As always, consult your doctor for the best timing to take this medication. The recommended dosage for Cromolyn sodium aerosol, spray with pump is 1 spray in each nostril, usually every 4 to 6 hours, or as directed by your doctor. It should be used 3 to 4 times a day, but not more than 6 times a day. It is important to use this medication every day that you are around allergens, such as during pollen season. Before using the spray, make sure to gently blow your nose. If your nasal passages are blocked, you may use a nasal decongestant first to open the passages. To use the spray, close one nostril with your finger and place the spray tip into the open nostril. As you breathe in through your nose, spray the medication into the open nostril. Repeat these steps for the other nostril. Avoid spraying the medication into your eyes, and be sure to rinse the spray tip with hot water or wipe it with a clean tissue after each use. It is important to use this medication regularly in order for it to be most effective. It may take 1 to 2 weeks of regular use to get the full benefit. If your condition lasts or worsens after 2 weeks, or if you think you may have a serious medical problem, stop using this medication and seek medical help. If you are still using this medication after 12 weeks, talk to your doctor. After using Cromolyn sodium aerosol, spray with pump, you may experience brief stinging or sneezing. If these effects persist or worsen, notify your doctor promptly. If your doctor has prescribed this medication for you, it's because they believe that the benefits outweigh the potential side effects. Many people using this medication do not experience serious side effects. However, if you experience frequent nosebleeds, sores in the nose, or wheezing/chest tightness, stop using the medication and inform your doctor immediately. While a severe allergic reaction to this drug is rare, seek medical help right away if you notice symptoms such as rash, itching/swelling, severe dizziness, or trouble breathing. Remember, this is not a complete list of potential side effects. If you notice any other effects, be sure to contact your doctor or pharmacist. If you're in the US, you can report any side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can report side effects to Health Canada at 1-866-234-2345. Before using this medication, make sure to inform your doctor or pharmacist about any allergies you may have, including any allergies to Cromolyn. This product may contain inactive ingredients that could cause allergic reactions or other issues, so it's important to discuss this with your pharmacist. If you have asthma or nasal polyps, it's important to consult your doctor or pharmacist before using this medication. If you are using this medication for self-treatment, let your doctor know if you have symptoms such as fever, discolored nasal fluid, sinus pain, or wheezing before using it. During pregnancy, this medication should only be used if clearly needed. Be sure to discuss the risks and benefits with your doctor. If you are breastfeeding, consult your doctor before using this medication, as it is unclear whether this drug passes into breast milk. It's important to be aware of potential drug interactions with Cromolyn sodium aerosol, spray with pump, as they can affect how the medication works and increase the risk of serious side effects. Make sure to keep a list of all the products you use, including prescription/non-prescription drugs and herbal products, and share it with your doctor and pharmacist. Always consult with your doctor before starting, stopping, or changing the dosage of any medicines. This will help ensure the safe and effective use of Cromolyn sodium aerosol, spray with pump. If someone has taken too much Cromolyn sodium aerosol and is experiencing severe symptoms like fainting or difficulty breathing, it's important to seek immediate medical help. In the US, you can call your local poison control center at 1-800-222-1222, while in Canada, residents can call a provincial poison control center. It's important not to share this medication with others to prevent the spread of germs. If you have allergies, try to avoid allergens that may trigger your symptoms, such as molds, pollen, grasses, weeds, dust mites, and pet dander. It's best to start using this medication a week before you expect to be exposed to allergens, like a week before your seasonal allergy symptoms typically begin. If you forget to use a dose, use it as soon as you remember. If it's almost time for your next dose, skip the missed dose and use your next dose at the usual time. Do not take a double dose to make up for the missed one. Make sure to check the storage information on the packaging and store this medication at room temperature, away from moisture and sunlight. It's important to keep it out of the bathroom and away from children and pets. When you no longer need this medication or it has expired, make sure to properly discard it. You can consult your pharmacist or local waste disposal company for the best way to do this. And remember, never flush medications down the toilet or pour them into a drain unless instructed to do so. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.